Welcome to the Al-Ghaf Dynamics HealthConnect Middle East podcast, your weekly roundup of healthcare, wellness, and life sciences developments across the region. I'm your host, and this edition covers the key stories from Wednesday, September 25th through Thursday, October 2nd, 2025. The past week saw a mix of bold new initiatives and persistent challenges. Governments and health authorities continued rolling out policies and collaborations to strengthen health systems, from UN meetings on Gaza and non-communicable diseases to regional tech summits on digital health. For example, Qatar's health minister used the UN General Assembly to press for more aid and protection of health services in Gaza, even as conflict casualties mounted. At the same time, researchers announced innovations like new genomics conferences and AI drug delivery capsules, and public campaigns promoted heart health and fitness activities. All this unfolded against a backdrop of ongoing crises. Gaza's hospitals are still overwhelmed by war injuries, Yemen's cholera outbreak persists at endemic levels, and humanitarian gaps strain health coverage. In this report we'll walk through 8 key sections, from policy and research to hospitals and population health, bringing you detailed, country-specific updates and analysis. Our sources include official health ministry releases, news agencies, WHO, UN updates, and NGO reports, all carefully cited below. Our information is drawn from regional health ministries, pharma and biotech institutions, advanced data and news outlets through our internal data and analytics platform, HealthConnect Middle East. First, we have healthcare policy and government initiatives. This week's health policy developments spanned UN forums and intergovernmental partnerships. Qatar took the spotlight at the United Nations in New York. On September 25th, Qatar's Health Minister Mansour bin Ibrahim Al Mahmoud co-chaired a high-level roundtable on healthcare in the Gaza Strip. In strong statements, he condemned the ongoing Israeli attacks as war crimes and called for the violence to stop, reaffirming Qatar's solidarity with Palestinians and pledging continued aid. Qatar also participated in UN-side events on childhood cancer and primary care, highlighting its broader health diplomacy agenda. These UN-level engagements followed Qatar's recent pledges to co-fund a new 400-bed hospital in Kandahar, Afghanistan, underscoring Doha's growing role in international health aid. See Hospitals section. Saudi Arabia likewise emphasized global health at the UN. A Saudi Ministry of Health delegation led by Deputy Minister Abdulaziz Al Rumayya presented the kingdom's contributions at UNGA 80. They showcased Saudi achievements in global health, linking new programs to Vision 2030 and the UN SDGs. One concrete initiative came on September 21st when KSA signed a cross-border digital health agreement with Syria. Under this agreement, Saudi doctors, including many Syrian physicians residing in Saudi Arabia, are now using Sayha Virtual Hospitals platform to consult with patients in Syria through telemedicine. Health Minister Fahd Al-Jalajel noted this project will improve care for war-wounded Syrians and accelerate Syria's health recovery after years of conflict. In Bahrain, Health Minister Dr. Jalila bint Abdulaziz Jawad Hassan attended the 6th Global Ministerial Mental Health Summit, September 30th to October 1st in Qatar. She used the forum to link mental health to chronic disease prevention, noting that a UN declaration on NCDs should now include concrete support for mental health. Dr. Hassan cited studies showing every dollar invested in mental health care returns more than $4 in societal benefits. Her message, that mental health promotion is an urgent government priority, reflects Bahrain's broader drive to reframe mental health as integral to public health policy. Other government actions around the region included Oman's outreach on non-communicable diseases. On September 25th, Oman held a high-level UN-side event in New York titled, One Vision, One Future, mobilizing global action to combat NCDs. Omani leaders explained that the country is scaling up prevention, through healthy lifestyles, salt reduction, and tobacco control, alongside expanding primary care access, having built 200 new health centers in recent years. Dr. Mona Ul said, Oman's Assistant Regional Director for Public Health, stressed that tackling NCDs is a moral responsibility and requires multi-sector collaboration on issues like air quality and nutrition. Meanwhile in Kuwait, the Ministry of Health continued efforts to modernize healthcare. The MOH joined the International Association of Medical Regulatory Authorities, IAMI, as a new member, aiming to align Kuwait's medical licensing and safety standards with global best practices. Health officials said this move, announced September 30, will help Kuwait contribute to global health governance and adopt innovations in medical regulation. Kuwait also launched its annual seasonal vaccination campaign on September 30, distributing 2.5 million doses of flu and pneumococcal vaccines to at-risk groups, part of the state immunization schedule. United Arab Emirates agencies also made policy news. For example, UAE's Emirates Scholar Center became the first Arab institutional partner of the European Medical Association. This strategic alliance, announced September 29, will bring EMA's 250,000 clinicians into collaboration with the center, supporting more than 20 joint research projects over 3 years in areas like rehabilitation medicine and digital health. The UAE's participation in international technical bodies, plus its hosting of many UN and WHO offices, continues to raise the country's profile in global health policy. On a regional level, GCC cooperation remains active. The GCC health ministers, meeting schedule not publicized this week, are expected to soon finalize standards for specialized treatments and emergency preparedness across borders. And WHO-UN regional offices convened consultations with government health ministries on issues like pandemic preparedness and UHC, though no new official communiques were released this week. In sum, governments across the Middle East used this week to signal policy momentum, from high-level declarations at UN summits to practical initiatives on vaccination and digital health. These measures underscore a broad commitment to Vision 2030-style reforms and international engagement, even as humanitarian crises persist. Now let's spend some time on life sciences and research innovation. Research and innovation continue to advance in the Middle East. Qatar remained a hub for genomics and translational medicine. Sidra Medicine, Qatar Foundation's flagship hospital, announced it will host the Precision Medicine and the Future of Genomics (PMFG) Summit in December 2025. The summit, now in its second year, will bring together genomics researchers and clinicians to discuss AI in genomics, clinical trial design, and population health. Sidra's CEO noted this builds on the hospital's decade-long leadership in precision medicine. Sidra was a site for Qatar's newborn genomic screening program and will set the agenda for implementing genomics discoveries locally. Notably, Zulal Wellness Resort, a Qatar spa, and other organizations are sponsoring the PMFG summit, signaling an integrated approach linking cutting-edge research with broader health and wellness goals. The preceding week Sidra also hosted its first Disease Modeling and Therapeutics (DMT) conference on September 29. Opening keynotes, attended by Her Highness Sheikha Moza, emphasized Qatar's vision of merging research and care. Sidra's CEO remarked that DMT 2025 is a platform where world-class innovation meets collaboration and will drive Qatar's ambition to be a center for stem cell and regenerative medicine breakthroughs. Scientific sessions covered topics like diabetes research, cell therapy, and organ regeneration. Professors from Weill Cornell Medicine Qatar and Cornell University presented joint projects on diabetes and genetics. The conference highlighted how Sidra's laboratories and the new Qatar Genomics and Precision Medicine Institute are turning ideas into treatments that can improve patient outcomes. In the United Arab Emirates, a notable announcement came September 29. The Emirates Scholar Center, a new Abu Dhabi-based research hub, joined the European Medical Association (EMA) as its first Arab institutional member. This partnership will give the UAE and the EMA mutual access to research networks and training. The Emirates Scholar Center's director said the deal will activate more than 20 joint research projects over the next 3 years, in fields from rehabilitation medicine to mental health innovation. At the same time, Abu Dhabi's global scientific events remain robust. The American College of Cardiology announced ACC Middle East 2025, Dubai, October 3 to 5, focusing on AI and prevention in cardiology, reflecting the region's hunger to learn about the latest research in critical fields. Saudi Arabia also saw research-driven news. a collaboration between King Abdulaziz City for Science and Technology, KACST, and the University of California, San Diego resulted in a smart capsule that can contain several medications and release them in a timed schedule. Announced September 1st, this multi-compartment drug capsule, dubbed an intelligent pill, is designed to improve patient adherence by simplifying multi-drug regimens. According to KACST scientists, such a system could reduce hospital visits and save up to 20% of Saudi healthcare costs by cutting medication misuse. This innovation exemplifies Saudi efforts to support local R&D in line with Vision 2030. Other notable efforts: Israel, though often not covered in regional reports, launched a Middle East-wide trial of an mRNA norovirus vaccine, in partnership with local institutes, aiming to curb common diarrheal illness. Jordan is piloting AI tools in radiology. Unaudited reports say several hospitals are testing software that flags tuberculosis and lung cancer on chest X-rays. And Egypt is expanding its health research infrastructure. The government recently approved major funding for university lab upgrades and local clinical trial centers to attract international studies. These national science initiatives, combined with the conferences and partnerships above, show a vibrant, if still catching up, research ecosystem in the Arab world. Overall, the Middle East's life sciences landscape is characterized by collaboration. The region is hosting more global conferences and drawing in international expertise, as in Qatar's Genomic Summit or the UAE's ACC meeting. Public-private partnerships are growing, as with the UAE EMA agreement, and governments are funding startup funds, see biotech section, and large grants. Despite uneven resources, these developments indicate a deepening commitment to R&D that could pay off in new therapies and public health tools. A number of key updates now in biotech and pharmaceutical developments. In biotechnology and pharma, Saudi Arabia is leading several initiatives this week. One highlight is a new venture fund. Sharot Ventures and Y Innovations announced a $50 million biotechnology fund on September 10. This fund, backed by Vision 2030 investment plans, will seed early-stage biotech startups focused on the Saudi and MENA markets. Dr. Rana Abugabal, a U.S. biotech veteran, and Dr. Huda Al-Fardas will lead the fund, targeting areas like personalized medicine and biologics. Officials noted that Saudi expects its domestic biotech industry to reach $11 to $12 billion by 2030, and this fund aims to help build the talent and companies to achieve that goal. A related move, Saudi launched a brand new regional biotech conference, BIO Middle East, planned for May 2026 in Riyadh. The health minister announced this first-of-its-kind meeting to gather scientists, entrepreneurs, and investors under one roof. The conference theme will be Creating Life Sciences Ecosystems, signaling the government's intent to turn KSA into a biotech hub. Minister Al-Jalajel emphasized that BIO Middle East aligns with Vision 2030's drive to diversify the economy through life sciences innovation. This follows Saudi's earlier success in hosting global events like the January 2025 Riyadh Expo on biomanufacturing. On the research production front, partnerships are in motion. KACST's Smart Pill, mentioned earlier, is a notable R&D achievement with pharmaceutical application. Gulf pharmaceutical companies also report modest progress. For instance, Tabuk Pharma, Saudi, has launched a facility for insulin analogues, and Jordan's Hikma Pharma expanded its vaccine contract manufacturing for export. However, we saw no major drug approvals or product launches announced this week. Instead, governments seem focused on building the ecosystem, funding, conferences, capacity, rather than celebrating end products. For example, Kuwait announced it will join a Gulf regulator alliance to standardize biosimilar approvals, but details are pending. One more example of a pharma initiative, the KSA Ministry of Health continues its campaign to localize essential medicine production. In September, officials reported that Saudi industry already meets 80% of local demand for generics and is on track to be self-sufficient in common drugs by 2027, part of Vision 2030 targets. While these reports are ongoing, they underline the trend of the region pushing biotech, biopharma forward. In summary, the biotech and pharma scene was highlighted by Saudi Arabia's new investments and events. The venture fund and conference announcements underscore a strategic push into biotech entrepreneurship. Traditional pharma activities, manufacturing capacity, clinical trials, growing steadily but without big week-over-week news. Overall, we see a region that is slowly building up its life science industry base, aiming to move from importing drugs to innovating them. Next we have public health challenges and disease outbreaks. Unfortunately, crises and disease outbreaks remained in focus. The Gaza conflict continues to produce a severe healthcare emergency. On the ground in Gaza, hospitals are overflowing. The Palestinian Health Ministry reports that over 167,000 people have been wounded since the fighting began in October 2023. Nearly half of Gaza's hospitals are now partially or completely out of service, and intensive care units are filled beyond capacity. An investigative report documents an acute shortage of pain relief in Gaza. Doctors have resorted to rationing one dose of pain medication per patient per day. Nearly all analgesics and anesthesia drugs are in extremely limited supply due to the blockade on imports. WHO staff quoted in the report warn that Gaza's medical supply chain has essentially collapsed. These desperate conditions have led to undertreatment of injuries, amputations without anesthesia, for example, and rising death tolls from otherwise manageable wounds. The humanitarian blockade and frequent strikes on medical facilities make this one of the world's worst active health crises. Beyond Gaza, Yemen's prolonged cholera epidemic is also intensifying. WHO data show over 282,000 suspected cholera cases and nearly 910 deaths in Yemen since 2023, making cholera endemic there. In late September, aid agencies reported that the outbreak is again surging. One recent study found nearly 20,000 new cases in June 2025 alone, an 87% increase over the prior month. The factors remain unchanged: collapsed sanitation, malnutrition, and crowded displacement camps fuel spread. The UN continues its vaccination campaigns, but logistical hurdles, fuel shortages, fighting, limit coverage. The result is a persistent risk of cholera outbreaks in several governorates. Health workers emphasize clean water and hygiene education as key preventative steps. In Lebanon, public health teams pivoted to influenza prevention as autumn approaches. On September 25, the Ministry of Public Health, backed by WHO and UNICEF, officially launched the 2025 National Flu Vaccination Campaign at Beirut's Rafik Hariri Hospital. The initiative aims to protect the most vulnerable, elderly, young children, pregnant women, chronic patients, from seasonal influenza, which can stress hospitals especially after years of civil strife. Health officials noted that integrating flu shots into the routine schedule is a major step toward resilience. The WHO representative praised Lebanon's success last year reaching displaced and conflict-affected groups. This ramp-up in preventive immunization, including new collaboration with private clinics for outreach, underscores how even crisis-impacted systems can maintain key services. Other disease trends are more chronic but still concerning. The region's non-communicable disease, NCD, burden remains extremely high. WHO data highlight that NCDs, heart disease, diabetes, cancers, etc., cause 66% of all deaths in the Eastern Mediterranean region. There are approximately 85 million adults with diabetes in the Middle East, 17.6% prevalence, the world's highest regional rate. An EMO meeting on September 30 stressed that conflict and population displacement are making chronic disease care even harder. Access disruptions lead to uncontrolled hypertension and untreated diabetes. Experts at the meeting called for integrating NCD services into all humanitarian and primary care settings, and for bold public health policies, salt reduction, tobacco taxes, obesity programs, to prevent new cases. Lastly, we note that endemic zoonotic threats persist. Middle Eastern Respiratory Syndrome, MERS, linked to camels, still circulates at low levels. WHO's latest summary, August 2025, reports a cumulative 2,627 confirmed MERS cases since 2012, with 947 deaths. 2,218 of those cases were in Saudi Arabia alone. While no major MERS outbreak occurred this week, health authorities in Saudi and elsewhere are vigilant during the autumn season of higher risk. In summary, public health in the region was shaped this week by acute crisis, Gaza war, Yemen cholera, and persistent challenges, NCDs, seasonal flu. International aid and WHO are scrambling to keep basic services running, while countries attempt immunization campaigns. These developments underline that even as new policies and technologies arrive, underlying health threats, from war injury to chronic disease, continue to define the regional health landscape. Now we will switch to wellness and health promotion. Alongside policy and crisis news, there were several notable wellness initiatives. Dubai rolled out an innovative fitness event on September 29, the first ever Mallathon, where thousands of residents ran laps inside air-conditioned shopping malls. The Mallathon tapped into Dubai's running club culture by offering a community-driven way to exercise safely out of the summer heat. Organizers partnered with health charities and corporate sponsors to make it more than a race. It became a platform for wellness, inclusivity, and purpose-driven brands, as one report described. By mixing family fun with exercise, the Dubai Mallathon exemplifies the creative wellness events emerging in the Gulf, aligning with leadership messages to promote active lifestyles. Global Health Awareness Days were also leveraged. World Heart Day, September 29, prompted regional experts to sound the alarm on cardiovascular risk factors. In commentary around the day, a Gulf-based cardiologist urged everyone to get 25 minutes of activity 25 days a month, as a simple goal for better heart health. He also highlighted successful regional policies on salt reduction, Jordan and Egypt, sugary drink taxes, parts of the Gulf, and the Who's Hearts program for blood pressure control. These recommendations reflect a shift from treatment to prevention. Health ministries in places like the UAE and Oman are increasingly running public campaigns on healthy eating, exercise, and quitting smoking, although no new mega-campaign announcements occurred this week. Mental health promotion continues to gain visibility too. As noted in the policy section, Bahrain's minister emphasized mental health at an international summit. Though most countries do not have specific, week of stories, health authorities are quietly expanding awareness programs. For example, Emirates Health Services in the UAE reported last year that it would launch national mental well-being campaigns through schools and mosques, and clinicians say preliminary work on those is underway. The Gulf News also reported plans by Kuwait to create a national wellness strategy focusing on stress management and family counseling. Details were still in draft. These efforts fit a larger trend. Gulf governments are increasingly framing mental wellness, healthy lifestyles, and community engagement as part of their health promotion agenda. Saudi Arabia reiterated its emphasis on voluntary blood donation, a campaign initiated by the Crown Prince, by organizing workplace drives in Riyadh. And many states continued school-based health checks. For example, the UAE's Emirates Health Services completed its annual training for 333 school clinic nurses, ready to screen students for vision, hearing, and nutrition issues starting in late September. In summary, this week's wellness news was dominated by themed events and campaigns. Dubai's Mallathon encouraged active lifestyles in a fun setting, while heart health advocates used World Heart Day to push simple exercise and diet goals. Always a massively key topic is digital health innovation. Technology and digital health continue to transform the Middle Eastern healthcare landscape. Saudi Arabia again demonstrated its digital-first approach. As mentioned above, the cross-border telemedicine link with Syria goes through the country's Sidra virtual hospital platform. In fact, on September 15, Saudi launched Sidra Virtual Hospital as the Middle East's first-ever nationwide virtual hospital. This massive system is now connected to about 130 hospitals across Saudi, allowing patients in remote areas to consult specialists via video. Sidra Virtual will offer 8 specialized clinics, cardiology, nephrology, oncology, etc., without physical walls. This architecture underpins projects like the Syrian link mentioned above, but also modernizes domestic care. For example, rural patients with chronic diseases can use telemonitoring devices to upload vital signs to Sidra doctors. In the United Arab Emirates, Dubai's big health conference HealthConnect, September 8 to 10, showcased regional progress. Organized by Dubai Health Authority, HealthConnect attracted over 5,000 attendees from 50-plus countries. Sessions covered AI diagnostics, telehealth platforms, and startups leveraging blockchain for medical records. Organizers highlighted Dubai's vision to be a global AI health hub. At the expo halls, dozens of local and international companies unveiled new apps, such as an AI app for retinal disease screening and a bilingual telemedicine chatbot in Arabic and English. DHA officials confirmed that by end 2025 they expect over 90% of healthcare facilities in Dubai to be connected via the WECA's interoperability platform, enabling electronic health records and e-prescriptions. These developments were featured in industry press, and keynote speeches underlined the region's push to digitize everything from emergency services to patient data. Egypt also made digital news. Telecom Egypt signed a deal with an international IT firm to deploy a national health information cloud. This platform will standardize patient records across Egypt's public hospitals. Using a government cloud backbone, the plan is to integrate hospital information management systems, HIMS, and create a unified electronic medical record. Officials say this will improve care coordination, reduce paperwork, and allow better planning, e.g. knowing how many beds or ICU ventilators are occupied. The partnership will begin piloting in Cairo hospitals this autumn, with a national rollout by mid-2026. This ambitious IT project, backed by the Ministry of Health and the National Unified Infrastructure, illustrates Egypt's broader e-health strategy to leapfrog old systems. Other digital health items. In Kuwait, work continued on linking insurance claims to digital records. Private insurer Daman is piloting an app for pharmacies to verify treatments. Oman piloted a new mobile app for diabetes patients to track glucose. The app also books free home nurse visits. And Saudi Arabia announced that future updates to its Ada e-health portal will include AI tools for triaging COVID-19 and flu cases. While not all these items were formally announced this week, they reflect a steady trend. In sum, technology is driving change. The startup ecosystem is booming. One industry report noted over 100 health tech startups founded in the Gulf in 2025, working on everything from teletherapy to remote surgical training. Governments are backing this with big digital health strategies. We saw evidence this week in Saudi's cross-border telemedicine project, Dubai's large-scale tech conference, and Egypt's national cloud initiative. Together, these digital health advances promise to improve access and efficiency, although cybersecurity and data privacy will be important issues to watch as all countries push forward. Hospitals is what we will cover next. Hospital news this week was a mix of grand openings and expansions across the region. In Saudi Arabia, Al Madad Specialized Hospital, a private network in Riyadh, announced its Eastern Wing expansion is nearly finished. This $40 million project will add 30 new inpatient beds and 12 more specialty clinics, a 23% increase in bed capacity, when it opens in Q4 2025. The expanded facility will include upgraded intensive care units and new surgical suites. Company executives report that patient volumes have grown sharply, and the expansion is needed to meet demand for advanced cardiac and oncological care. Once complete, Al Madad will serve tens of thousands more patients per year, underscoring private sector confidence in Saudi's healthcare market. In the United Arab Emirates, a major government-run hospital opened its doors in July, Sheikh Khalifa Hospital in Fujairah. This 843 million dirham facility has 222 beds, with space to expand to 350, and occupies 89,000 square meters. The hospital, named for the late President Sheikh Khalifa bin Zayed, features 3 centers of excellence for burns, trauma, and rehabilitation, which are firsts for the Northern Emirates. Government leaders said the hospital will significantly improve specialist care access for over 1 million residents of Fujairah and its neighboring areas. Inaugural statistics indicate the ER is already averaging 300 patients per day. With this hospital, Fujairah transitions from relying on Dubai Abu Dhabi facilities to having its own high-end tertiary care center. Bahrain saw a private hospital expansion as well. Bahrain's Al-Hilal Healthcare Group completed the acquisition and rebranding of Middle East Hospital in Sigaya into Al-Hilal Premier Hospital, launched in late September. The new Premier Hospital has 65 beds and offers a range of specialties: cardiology, orthopedics, pediatrics, etc. Al-Hilal described this as the largest single hospital acquisition in Bahrain's private sector, reflecting consolidation in the market. They are adding a new cardiac catheterization lab and expanding ICU capacity. This bolsters Bahrain's hospital capacity, which had been stagnant amid rising chronic disease burdens. Health regulators said the upgrade will help reduce wait times for operations and improve local training for Bahraini nurses. Regionally, Qatar made headlines by committing to a new hospital abroad. At a signing ceremony this week, Qatar's Ministry of Public Health and Qatar Charity finalized and vowed to build a 400-bed specialized hospital in Kandahar, Afghanistan. Qatar will fully fund the project through its charity arm. Afghan officials said the Kandahar hospital, due in till the 30 months, will fill a critical gap in maternal and child healthcare for southern Afghanistan. Though the project lies outside the Middle East, Qatar's leadership is heralding it as part of their health diplomacy strategy. It signals that Gulf states are exporting healthcare investment as an element of foreign policy, a notable trend after UAE's funding of hospitals in East Africa earlier in 2025. Finally, Saudi Arabia's Sidra virtual hospital merits mention here too. Launched mid-September, it's being called the Middle East's first virtual hospital. While not a brick-and-mortar facility, Sidra Virtual connects 130 actual hospitals via telemedicine. It offers round-the-clock remote consults in cardiology, nephrology, oncology, and more, effectively extending the hospital network digitally. In effect, Saudi has created a hospital without walls, allowing specialists in Riyadh or Jeddah to treat patients in far-flung clinics via video link. This innovation is already relieving pressure on rural clinics and will be a focal point of Saudi's healthcare strategy, illustrating that hospitals now come in digital form as well as physical. Across the Middle East, these hospital developments reflect two forces: the growth of healthcare infrastructure in wealthier states and the use of health investment as soft power. Wealthy Gulf governments keep building bigger and better facilities at home, often tied to Vision 2030 type plans. At the same time, Qatar and the UAE are building and financing hospitals abroad. The result is a notable expansion of hospital capacity in this decade. From Riyadh to Manila, Gulf dollars are extending global healthcare reach. Domestically, long waiting lists are shrinking in places like UAE and Saudi as new beds come online. However, the region still faces underserved areas, rural Yemen, war-torn Syria, that are not covered by these projects. Bridging that gap remains a challenge, even as policymakers celebrate each new hospital ribbon-cutting. Finally, we have population health management. The final segment covers how countries are managing health for whole populations. A strong focus was on prevention and monitoring. In the UAE, Emirates Health Services reported extensive preparations for the new school year, starting this week. EHS now provides health services in 312 government schools, with 333 clinic stations. These school health units have been fully staffed and stocked, ready to resume student vision, hearing screenings and immunizations. Last year, EHS administered 95,000 student vaccines through school clinics. EHS officials say they are expanding their protocols, including training thousands of school nurses and opening dedicated healthy living webinars for students and parents. This highlights the UAE's community health approach. By embedding nurses in schools, they aim to catch health issues, obesity, asthma, vision problems, etc., early and guide children toward healthier habits. In Kuwait, public health authorities kicked off a major health survey. On August 27, the Ministry of Health launched the first awareness campaign for the Kuwait National Health Survey. The survey, underway all September, uses government mobile app, Sahel, to invite a random sample of 12,000 individuals, from 8,000 households, across the country. Participants will answer questions on smoking, diet, exercise, and chronic conditions, and undergo basic health measurements. MOH officials say this will be the largest population health study in Kuwait, intended to establish baseline data on NCD risk factors and health status. Results from the survey are expected by 2026 and will inform policies like taxes on tobacco, sugary drinks, and expansion of primary care. Another WHO-backed initiative addressed cross-border health threats. In late August, UEMRO facilitated a sub-regional simulation exercise in Cairo, August 18 to 20, 2025. Officials from Egypt, Libya, Tunisia, and Sudan, plus WHO and IOM, tested their joint response to mass population movement, thinking through scenarios like an infectious traveler or mass exodus from conflict. The exercise identified gaps in coordination. Participants recommended establishing formal, steering committees, and annual drills for information sharing on outbreaks and medical screening. This effort echoes WHO's persistent push to systematize migrant health management. Its conclusion was that only by integrating data systems and stockpiles, e.g. region-wide vaccine stock, agreed protocols for border screening, can these countries protect travelers and refugees, in line with Eastern Med region health security goals. WHO also underscored the region's NCD crisis in population terms. At a September 30 summit, WHO experts noted that 2/3 of EMR deaths are now from chronic diseases like heart disease and diabetes. They pointed out that 85 million adults in the region have diabetes, a prevalence of 17.6%, the highest globally. These numbers emphasize the need for population-level interventions. WHO urged countries to scale up best buys, for example, countrywide salt reduction in bread, tobacco tax increases, and hypertension control programs, which are proven to cut disease burdens. Many Gulf health authorities say they will incorporate WHO's recommendations into their forthcoming national health plans. Finally, addressing basic health system capacity, governments reported improving primary care reach. Saudi officials recently said that with Vision 2030 funds they opened dozens of clinics in underserved areas, and are launching mobile medical units for remote communities. A WHO 2025 profile notes that Oman now achieves 98% immunization coverage for measles in under 5s, thanks to outreach in villages, no specific new news, but an example of success. The UAE is mapping population health metrics in each emirate to guide future hospital locations. And Syria, despite its crisis, maintains one of the highest regional vaccination rates, due to years of outreach, though war disruptions have caused some drops. In short, population health management in the Middle East is taking a multi-pronged approach: better data, via surveys and e-records, expanded primary care, school clinics, mobile units, and robust preventive campaigns, vaccines, NCD screening. The week's highlights: school health readiness in UAE, Kuwait's health survey launch, WHO-led regional simulations, and WHO NCD summit recommendations reflect this strategy. Countries still face challenges in data collection and reaching hard-to-access groups, but these initiatives show a clear intent to manage health at the population level, not just at the point of care. Let's summarize this week's review. In summary, the week of September 25 to October 2, 2025 underscored both progress and ongoing struggles in Middle Eastern health. Policymakers advanced major initiatives on the global stage, from Qatar and Saudi at the UN advocating for Gaza relief and highlighting Vision 2030 health reforms, to GCC ministers planning harmonized standards. New partnerships, like UAE's Emirates Scholar joining Europe's EMA, and events, Saudi's upcoming BIO Middle East Summit, signal growing investment in science and innovation. The life sciences sector saw concrete achievements: Qatar's Sidra Advanced Genomic and Regenerative Medicine conferences, Saudi and US teams unveiled a smart drug capsule, and the UAE struck new research alliances. Pharmaceutical and biotech progress was highlighted by Saudi's launch of a $50 million biotech fund and a planned regional conference. However, on-the-ground health challenges remained stark. The Gaza war inflicted terrible human cost, with hospitals overwhelmed and drug shortages causing unprecedented hardship. Yemen's cholera outbreak, entering its third year, spiked alarmingly again. Beyond emergencies, non-communicable diseases continue to dominate the mortality profile, prompting WHO to renew calls for prevention and health promotion. Despite these trials, governments and societies in the Middle East took tangible steps to improve health. Vaccination drives in Lebanon and Kuwait aimed to protect the vulnerable, school health programs expanded in the UAE, and novel community events, like Dubai's Mallathon, encouraged fitness. Hospitals expanded and opened new wings from Riyadh to Fujairah, and digital health platforms multiplied, from Saudi's giant virtual hospital to Egypt's new cloud system. Looking forward, the region's health outlook will hinge on sustaining this momentum. The upcoming weeks promise more: international summits on NCDs, flu season campaigns, and the start of Breast Cancer Awareness Month, Pink October. The key will be linking policy to action and resources. Our coverage found that countries are increasingly collecting data, through surveys and EHRs, and training healthcare workers for prevention. If these efforts continue and adapt to crises, they could gradually improve outcomes despite the region's complex challenges. For now, Middle Eastern health leaders are sending a consistent message: they recognize the needs, whether war casualties or metabolic diseases, and are pursuing integrated solutions through policy reforms, innovation, and community engagement. For more information about any of the topics discussed here, or if you would like to learn more about Al-Ghaf Dynamics and our extensive range of services and solutions in healthcare, life sciences, and wellness for the Middle East, please don't hesitate to contact us. Visit us at our website or email us directly. Additionally, scan our QR code for all our links. Thank you for listening and see you next week.